Hi, I'm Mehul, and today we're going to talk about anthropometric characteristics of girth measurements of the upper and lower extremity. So an anthropometric characteristic is a trait that measures body composition such as height, weight, girth, and body fat composition. So today we're going to focus on girth measurement. A girth measurement is basically a circumferential measurement along the leg, the arm. It can also be on your hand and your ankle. My patient here, Ray, he said he has got some swelling in that right arm. So what we're going to do is we're going to take a look at it. You want to identify one landmark. So you can use either the medial or the lateral epicondyle. I'm going to use the medial. I'm going to palpate it, place my initial mark, and then I'm going to use my measuring tape to go 3 points below that initial mark and 3 points above. So you want to make sure those points are equidistant. So for his arm, I thought to address it, it'd be good to do about 5 centimeters each. So I'm going to start at the top, make my way down, and then as I make my way down, you want to make sure you hit each of the 7 individual points. You take each individual measurement. So you're going to measure those 7 points right there, and then you also want to make sure you compare it on the other side as well. The figure 8 measurement of the hand. So to check for swelling, what you're going to do is you're going to make sure that the patient keeps their hand off of the table, flexed in a neutral position with the fingers put together and the thumb extended out. After that, what you want to do is you want to start at your radial styloid process, make your way to the base of your 5th metacarpal, around to the base of the 2nd metacarpal, and then back over to the ulnar styloid process. I'm going to wrap that around. And you want to flip the hand to make sure that it's hitting all of your landmarks. Adjust as needed. All right, and then flip back over. Just gonna correct this. Flip back over. And then take your reading. So now we're gonna take a look at this right leg here. So we're gonna get circumferential measurements from the knee. So I'm gonna use the superior patellar tendon as a landmark. I'm gonna make my initial mark there. And then same thing as the upper extremity, I wanna make sure that I'm getting 3 equidistant points above and 3 equidistant points below. So I'm going to do about 15 centimeters on the top and 15 centimeters on the bottom. All right, so similar to the upper extremity, I want to start at that topmost point and make my way down, measuring each of those 7 marks. So you want to make sure that the tape measure is nice and snug and that the skin isn't being depressed at all. All right, so again, just like any measurement, any girth measurement, you want to make sure you're comparing both sides. So you have your landmark and you have the measurement on both sides in centimeters. So similar to the hand, you can do a figure 8 measurement of the ankle as well. So we're going to start at his anterior tibialis tendon, and then we're going to bring it over to the distal part of his navicular, the tuberosity of the navicular. You're going to find that, and then you're gonna make your way over the proximal base of the 5th metatarsal, distal to the medial malleolus, and then distal to the lateral malleolus. And then you are going to take your measure. So just a couple of takeaways. When talking about circumferential measurements, you wanna make sure that you're addressing their swelling each visit and seeing how it changes over time. On each visit, you want to make sure to measure each side 2 to 3 times and that it's precise within 5 millimeters. Again, this is a comparative measure, so that's going to involve assessing both sides. That's crucial to kind of see how the swelling is compared to the other side. And now you know everything about circumferential girth measurements.